Did you know that there are natural herbs that can clear your lungs, eliminate mucus, and even fight viruses? Today, we're going to explore a hidden world of powerful medicinal plants that can transform your lung health. Get ready to discover ancient secrets that the pharmaceutical industry doesn't want you to know. Stay with us until the end and be amazed by the power of nature. 1. Eucalyptus. Eucalyptus is a tree native to Australia, used by Aborigines for centuries to treat respiratory problems. Its use has spread around the world due to its impressive medicinal properties, especially in the treatment of respiratory diseases. Aborigines used to boil its leaves to inhale the steam, thus relieving congestion and other respiratory symptoms. Eucalyptus essential oil is known for its expectorant properties, helping to clear mucus from the lungs and relieve coughs. In addition, it has anti-inflammatory properties that can help reduce inflammation in the airways, improving breathing. Scientific studies also show that eucalyptus has antimicrobial properties, helping to fight infections that can affect the lungs. In addition to its benefits for the lungs, eucalyptus is also used to relieve muscle and joint pain. Its essential oil is commonly found in creams and ointments for pain relief. Eucalyptus is also used in aromatherapy to reduce stress and improve general well-being, thanks to its refreshing and calming aroma. Eucalyptus is usually consumed in the form of essential oil for inhalation. The recommended dose is to add 3 to 4 drops of eucalyptus essential oil to a bowl of hot water and inhale the steam for 5 to 10 minutes. Not recommended for internal use. Pregnant and breastfeeding women should avoid using eucalyptus essential oil. 2. Peppermint. Peppermint is a hybrid plant that originated in Europe and is known for its refreshing aroma and medicinal property. This plant has been used since ancient times by the Greeks, Romans, and Egyptians. They valued peppermint not only for its taste and aroma, but also for its healing property. Rich in menthol, peppermint helps open the airways and makes breathing easier. Menthol has a relaxing effect on the muscles in the airways, which can relieve symptoms of asthma and other respiratory conditions. In addition, peppermint has antiviral and antibacterial properties, which help protect the lungs from infections. It is also effective in relieving headaches and digestive problems. Peppermint oil is often used in treatments for irritable bowel syndrome, IBS, due to its antispasmodic property. In addition, the menthol in peppermint can provide a cooling sensation on the skin, making it useful in products to relieve itching and irritation. Peppermint can be consumed as tea or essential oil. For tea, use 1 teaspoon of dried leaves in a cup of boiling water. The essential oil should be diluted before use. Pregnant and breastfeeding women should consult a doctor before consuming peppermint. 3. Licorice. Licorice is a plant native to the Mediterranean and Asia that has been used for millennia in traditional Chinese and Ayurvedic medicine. Licorice root has been valued for its natural sweetening and therapeutic properties. In ancient China, it was one of the most common ingredients in herbal mixtures to treat a variety of ailments. It has anti-inflammatory properties that help relieve inflammation of the lungs and bronchi. Licorice also acts as a demulcent, forming a protective layer on the mucous membranes of the respiratory tract, which can be especially useful in cases of dry cough. In addition, its antiviral properties help fight respiratory infections such as the common cold and flu. It is used to treat stomach ulcers and improve digestive health. Glycyrrhizin, a compound found in licorice, helps protect the gastric mucosa and promote ulcer healing. Licorice has also been used in treatments for adrenal insufficiency due to its ability to influence cortisol production in the body. Licorice is usually consumed in tea or extract. The recommended dose is 1 to 5 grams of dried root per day. Prolonged use can cause hypertension and fluid retention. Pregnant women, nursing mothers, and people with high blood pressure should avoid licorice. 4. Thyme. Thyme is a Mediterranean herb with a long history of culinary and medicinal use. It was used by the ancient Egyptians in the embalming process due to its antimicrobial property. The ancient Greeks also used thyme in their baths and burned it as incense in temples, believing that it brought courage. It has antimicrobial properties that help fight respiratory infections and eliminate mucus. Thyme contains thymol, compound with powerful antibacterial and antifungal properties. This compound is effective in eliminating pathogens that can cause respiratory diseases. In addition, thyme is a natural expectorant, helping to loosen and expel mucus from the lungs. It is also used to treat acne and improve digestive health. Thyme essential oil is often found in skincare products due to its antibacterial and anti-inflammatory property. In traditional medicine, thyme is also used to relieve digestive problems, such as indigestion and gas. Thyme can be consumed as tea or essential oil. For tea, use 1 to 2 teaspoons of dried leaves in a cup of boiling water. The essential oil should be diluted before use. Pregnant and breastfeeding women should consult a doctor before using thyme. 5. Ginger. Ginger is a root native to Southeast Asia, widely used in cooking and traditional medicine. Historical documents show that ginger was a valuable commodity in the spice trade between India and the Roman Empire. It was also used in traditional Chinese and Ayurvedic medicine for its therapeutic property. Anti-inflammatory properties help reduce inflammation in the lungs and relieve coughs. Ginger contains bioactive compounds such as gingerol and shogol, which have anti-inflammatory and antioxidant effects. These compounds help relax the muscles in the airways, making breathing easier and relieving asthma symptoms. Ginger can be consumed fresh, in tea, or as a supplement. For tea, use 1 to 2 teaspoons of grated fresh ginger in a cup of hot water. Pregnant women can consume ginger in moderate amounts to relieve nausea, but should consult a doctor first. Ginger is also famous for relieving nausea and improving digestion. It is commonly used to treat morning sickness, during pregnancy, and to relieve chemotherapy-induced nausea. In addition, ginger can help reduce muscle and joint pain due to its anti-inflammatory properties. Ginger can be consumed fresh, in tea, or as a supplement. For tea, use 1 to 2 teaspoons of grated fresh ginger in a cup of hot water. Pregnant women can consume ginger in moderate amounts to relieve nausea, but should consult a doctor first. Oregano. Oregano is a Mediterranean herb known for its antioxidant, antibacterial properties. The use of oregano dates back to ancient Greece, where it was a symbol of joy and happiness. The Romans also used oregano both in their cooking and in home remedies. It helps fight respiratory infections and eliminate toxins from the lungs. Oregano contains carvacrol and thymol, compounds with potent antibacterial and antiviral properties. These compounds help eliminate bacteria and viruses that can cause respiratory infection. In addition, oregano has antioxidant properties that help protect lung cells from damage caused by free radicals. In addition to its benefits for the lungs, oregano is used to improve digestive health. It can help relieve digestive problems such as bloating and indigestion due to its carminative properties. Oregano essential oil is also used in aromatherapy to relieve stress and improve mood. Oregano can be consumed as a tea or essential oil. For tea, use 1 to 2 teaspoons of dried leaves in a cup of boiling water. The essential oil should be diluted before use. Pregnant and breastfeeding women should avoid using oregano essential oil. 7. Nettle. Nettle is a common plant in Europe and North America and has been used for centuries in traditional medicine. Its leaves have small urticating structures that release chemical substances, cause itching and irritation on the skin. Despite this, nettle has been valued for its medicinal properties since ancient times. It has antihistamine properties that help relieve respiratory allergies and reduce inflammation. Nettle can help reduce the symptoms of seasonal allergies, such as allergic rhinitis, by blocking the production of histamine in the body. In addition, its anti-inflammatory properties can help relieve inflammation in the airways, making breathing easier. Nettle is also used to treat arthritis and improve hair health. Studies show that nettle can help reduce the pain and inflammation associated with arthritis, thanks to its anti-inflammatory compound. In addition, nettle is often used in hair products to strengthen hair and stimulate hair growth. Nettle can be consumed as a tea or supplement. Tea, use 1 to 2 teaspoons of dried leaves in a cup of boiling water. Pregnant and breastfeeding women should avoid using nettle as it can stimulate uterine contraction. 8. Ginseng. Ginseng is a root that originated in Asia and is valued in traditional Chinese medicine for its invigorating effects. There are 2 main varieties of ginseng: Asian ginseng, Panax ginseng, and American ginseng, Panax quinquefolius. both used for their adaptogenic properties. It helps strengthen the immune system and improve lung function. Ginseng contains ginsenoside, compounds that have anti-inflammatory and antioxidant properties. These compounds help improve immune function and protect lung cells from damage, as well as improving lung capacity and physical endurance. Ginseng is also known to increase energy and improve cognitive function. It is widely used to combat fatigue and improve concentration and memory. In addition, ginseng is considered a natural aphrodisiac and can help improve sexual function and general vitality. Ginseng is usually consumed as a supplement or tea. The recommended dose is 200 to 400 milligrams of ginseng extract per day. Pregnant and breastfeeding women should avoid ginseng as it can affect hormone levels. Turmeric. Turmeric is a root that originated in South Asia and is widely used in Ayurvedic cooking and medicine. The main active compound in turmeric is curcumin, known for its potent anti-inflammatory and antioxidant property. Turmeric has been used for thousands of years in India, not only as a spice, but also as a natural remedy. It has anti-inflammatory properties that help relieve inflammation in the lungs and fight infection. Curcumin can inhibit inflammatory molecules and help reduce inflammation in the airways, improving breathing. In addition, turmeric has antioxidant properties that help protect lung cells against oxidative damage. Turmeric is also used to improve skin health and reduce joint pain. Curcumin has been shown to be effective in treating skin conditions such as acne and psoriasis due to its anti-inflammatory and antibacterial properties. In addition, turmeric is often used to relieve the pain and stiffness associated with conditions such as arthritis. Turmeric can be consumed as a supplement or as a powder in food. The recommended dose is 500 to 2,000 milligrams of curcumin per day. Pregnant and breastfeeding women can consume turmeric in dietary quantities, but it is always advisable to consult your doctor for further advice. 10. Sage. Sage is a Mediterranean herb known for its medicinal and culinary property. In ancient Rome, sage was considered a sacred herb, used in religious and medicinal rituals. The ancient Egyptians also used it to treat infertility and health problems. It helps relieve nasal congestion and improve respiratory function. Sage has volatile compounds that can help open up the airways and relieve congestion. Antimicrobial properties also help fight respiratory infections, making it effective in treating colds and flu. It is also effective in treating inflammation of the mouth and throat. Sage is commonly used in gargles and mouthwashes to relieve sore throats and inflamed gums. In addition, sage has antioxidant properties that help protect the body's cells from damage. Sage can be consumed as a tea or essential oil. For tea, use 1 to 2 teaspoons of dried leaves in a cup of boiling water. The essential oil should be diluted before use. Pregnant and breastfeeding women should avoid using sage without medical advice. 11. Rosemary. Rosemary is an herb native to the Mediterranean and has been used since ancient times for its therapeutic properties. In ancient Greece and Rome, rosemary was often associated with memory and fidelity. It was also used in religious ceremonies and as a multifunctional medicinal plant. It has antioxidant properties that help protect the lungs from damage caused by free radicals. Rosemary contains rosmarinic acid and carnosol, compounds that have antioxidant and anti-inflammatory effects. These compounds help to reduce inflammation in the lungs and improve respiratory health. Rosemary is also used to improve memory and reduce stress. Studies show that the aroma of rosemary can help improve concentration and memory. In addition, rosemary is used in aromatherapy to relieve stress and improve mood, providing a sense of well-being. Rosemary can be consumed as tea or essential oil. For tea, use 1 to 2 teaspoons of dried leaves in a cup of boiling water. The essential oil should be diluted before use. Pregnant and breastfeeding women should consult a doctor before using rosemary. 12. Echinacea. Echinacea is a plant native to North America, valued by Native Americans for its healing properties. They used echinacea to treat a variety of conditions, including infections, insect bites, and wounds. In Europe, echinacea gained popularity in the 19th century as a natural remedy for colds and flu. It helps strengthen the immune system and prevent respiratory infection. Echinacea contains compounds that can increase the production of white blood cells, helping the body to fight infections. In addition, its anti-inflammatory properties can help relieve inflammation in the airways, improving lung function. In addition to its benefits for the lungs, echinacea is used to treat colds and flu. Studies suggest that echinacea can reduce the duration and severity of cold and flu symptoms. It is also used in skincare products to help treat acne and other inflammatory skin conditions. Echinacea can be consumed as a tea or supplement. The recommended dose is 300 to 500 milligrams of echinacea extract 3 times a day. Pregnant and breastfeeding women should avoid using echinacea without medical advice. Exploring the power of herbs to improve lung health is like discovering a hidden treasure. Each of these plants offers unique benefits that can transform your life. Don't underestimate the power of nature. You can use these herbs in teas, inhalations, and supplements to obtain their benefit. Many of these herbs can be combined to enhance their effects, but always consult a health professional first. Although generally safe, some herbs can cause allergic reactions or interact with medications. Pregnant and breastfeeding women should not consume herbs, teas, or supplements without medical supervision. Always consult a doctor before starting any treatment, especially if you have any health restriction. Watch our next video to find out more about how other herbs can be beneficial to your health.
Thanks for watching. We love that you're joining us. Subscribe, explore our channel, watch more videos, and embark on your journey to wellness with HealthToday.